Hi, my name is Dr. John Wessling, and today I would like to talk to you about fibromyalgia. Fibromyalgia is a rather common and chronic disorder characterized by widespread muscle pain, fatigue, and multiple tender points. Tender points that are specific places on our body: our neck, shoulders, back, hips, even our upper and lower extremities. Now, in addition to pain and fatigue, people who have fibromyalgia may experience morning stiffness, headaches, insomnia, irritable bowel syndrome, numbness or tingling of the extremities, painful menstrual periods, restless leg syndrome, cognitive and memory problems, sometimes referred to as fibrofog. Now, between 80 and 90% of those diagnosed with fibromyalgia are usually women. And most fibromyalgia patients are diagnosed based on two criteria. The first is a history of widespread pain lasting more than 3 months. And then the second is the presence of tender points. Now, there are 18 different sites on our body that are designated as possible tender points. And for a fibromyalgia diagnosis, a person must have at least 11 or more of these tender points. Now, at this point, I would like to share with you some amazing information on the causes of fibromyalgia that you probably haven't heard of before. Fibromyalgia affects our muscles. That's true. But it is not a muscle problem. It is a nervous system problem. It is a neurological problem. In other words, it's a brain-based problem. Now, I'm not saying necessarily that it's all in your head, but I am saying that it could possibly originate in your head. So let me explain. There are three parts to the brainstem located right here: the upper and the middle and the lower brainstem. And normally your brain fires impulses down to the lower two parts of the brainstem, and that slows or inhibits or quiets down the upper brainstem. And with fibromyalgia, this doesn't happen. The lower part of the brainstem down here does not slow down the upper brainstem. In other words, at this point, the upper brainstem is hyperactive, it's too excitable, it's too irritable, which will create havoc in your body. So what kind of havoc will this cause? Well, for one, insomnia or difficulty sleeping, which is one of those problems that fibro patients quite often have. And the reason for your headaches is because the upper brainstem is overfiring or hyperactive due to the fact that the brain is not firing impulses to the lower brainstem, and then the lower brainstem is not inhibiting the upper brainstem. Also, this area of the brainstem has connections down here into the abdominal area or into the intestines, and when it is hyperactive, then you have irritable bowel syndrome, which is characterized by episodes of diarrhea and constipation, maybe even abdominal pain or nausea or even vomiting. Now, due to the overstimulation of the upper brainstem, this will cause you to experience maybe an increased heart rate or irregular heartbeat, or maybe even both of these at the same time. Also, an overactive upper brainstem can overload your adrenal glands, which sit right above your kidneys, and they can secrete too much cortisol. When this happens, it can cause considerable amount of pain. So when this occurs, the fibromyalgia patient may have headaches one day, knee or leg pain the next day, back pain the day after that, and then they may have pains along their arms and the shoulders. In other words, they have all these different types of pain. Now, cortisol in areas of the brain can really create that fibrofog. In other words, that difficulty of finding the right words to say or being able to enunciate them clearly. Now, stress has been known to be the biggest factor as to why your brain and the nervous system do not function correctly, sending these electrical impulses down into the lower brainstem to slow down the upper brainstem. Stress can occur from a physical or emotional or chemical reason. Physical stress can come about from car accidents, falls, bumps, or bruises. Emotional stress due to some financial difficulty, a divorce, abuse, or even difficulties at work. Chemical stresses can be from hormonal or metabolic imbalances, or side effects of certain medications or drugs, or even junk food. Now, see, all of these severe stresses on your body causes your brain, your nervous system to misfire or malfunction. So, okay, what do we do to fix it? What makes us different from all the other doctors that you have seen? Well, we treat fibromyalgia from a neurological and a metabolic perspective. In other words, we do a functional neurological exam to check your brain and nervous system that contributes to your pain, your fatigue, your insomnia, and your brain fog. And then we do clinical testing, including urine and saliva and blood chemistry analysis, and really evaluate to see if there's any hormonal or metabolic imbalance. So often there are chemical and inflammatory causes to your fibromyalgia. We then devise a natural approach to treat on the source of your inflammation and pain. The clinical tests, the laboratory testing, including the urine and saliva that we do, is done to determine your underlying metabolic state, which may be the integral key to your recovery. So the only approach that makes sense, that has a chance at all in making a real change in treating your fibromyalgia, is to look at everything all at once. And in so doing, it then becomes clear that everything is not necessarily normal, as is so commonly perpetuated by doctors that prescribe medication for such a complex problem. The key to successfully treating fibromyalgia is to restore function to your body in the form of therapy to your brain and nervous system, and then also by correcting your metabolic imbalances. Patients who have had fibromyalgia in the past once thought they were going to be debilitated and were going to have to live the rest of their lives on the sidelines. And now they have been able to get their lives back. But it was only possible because the right evaluation and treatments were done. So if you're looking for a doctor that is willing to sit down with you knee to knee and find out who you are, see how you've been treated, and who is willing to understand how you feel, and then provide you with some hope, then at the bottom of this page you will find an area to fill out for more information. We will then send you an online link to a video that will explain all the different treatments that we do to make our care so unique and successful.